Hey there, Dogg from Air Fans. Evan-Benton here, and I'm going to be looking at the FDA document granting approval to the Pfizer-BioNTech COVID vaccine. So just the stuff that you need to know before I get into the nitty-gritty of actually reading through it. So there's a thing going around the interwebs which is claiming that it's not approved, and what they just did is they extended the emergency use authorization for it, and that is false according to the document. And as I go through, I'll explain where they, that's what they say, and what they did. I understand the confusion. So they renamed the Pfizer vaccine. Okay, the old name is the Pfizer-BioNTech COVID-19 vaccine. And the new name is Comirnaty, which sounds like a really bad, high school, science project. It's a really stupid name. I'm sure it has like a cult numerological significance if someone wants to look into that. But anyway, they gave it a new name, and it's going to be licensed under the name Comirnaty. And so the doses that were produced under the old name, which was Pfizer-BioNTech COVID-19 vaccine is the old name. I don't know why, but they can't apparently just change those, change the label or something. And so the main point of the EUA that's continuing in this announcement is that it's going to allow those doses to be used interchangeably, of course, with the new Comirnaty. And the other point is that there will be an EUA for children 12 to 15 years old. So the approval is for 16 and up, which there's no need for a child to get this. That's absolutely idiotic and probably demonic, because nobody in that age is at risk from dying or even having serious symptoms of COVID. And then also for the immunocompromised, they have approved a third dose. So if you're real stupid, get a third dose of COVID, the vaccine I'm in. And so just my little editorial I'm going to keep up front. If this announcement, so yeah, first of all, yeah, it's a bummer. Sorry to deflate the hopium bubble there, but it's officially approved, okay, in less than a year. So my editorial speech is, if this changes how you feel, if this makes you decide to get the jab, you're an idiot. This is that's so dumb. Now, getting the jab, first of all, is a stupid thing, but smart people do stupid things, okay? If you think that this means that this is all healthy and whatnot, after just over 9 months that it's been around, you're an idiot and you're a danger, and God help you. So that's my editorial. Let's get over to the paper here. Okie dokie. Here we are. So it's a letter from Pfizer, it's a letter from the FDA, official FDA letterhead to Pfizer. Not sure who she is. I didn't look her up. All right, but so we're saying. So first of all, this is the basis. Okay, the basis for this whole shebang is the public health emergency. And so it's kind of interesting they feel they need to restate that. There's a little bit of, tongue-in-cheek tone throughout this whole thing. And then section 564, this is, if you want to look that up, let's see, I have it pulled up here, I think. Authorization for medical products for use in emergencies. This is the whole U.S. code that they're referring to, the rules, the law that they have to actually follow when they're doing this. And so what they're doing with this paper is they're, demonstrating how it follows those laws and such. Now, for a little bit of history, the Secretary of Health and Human Services on March 27th, 2020 declared that circumstances exist justify the authorization of emergency use of drugs and biological products. Biological products meaning vaccines during the COVID-19 pandemic. So the declaration of emergency, which was Donald Trump, I can't remember what day that was, but here in New Orleans, we went into lockdown on March 17th. So reasonable question to ask, first of all, is what kind of data did they have on this date, March 27th, to make the decision that circumstances exist justifying the authorization of emergency use of drugs and biological products? And then secondly, who is making this decision? Who was the Secretary of Health and Human Services under Donald Trump? Well, he was Alex Azar. Is Alex Azar a doctor? Is Alex Azar a scientist? Nope. He's a politician, an attorney, a businessman, a lobbyist, and a former pharmaceutical executive. Pharmaceutical executive for Eli Lilly, and member of the board of directors of the Biotechnology Innovation Organization. So he's a lobbyist for Big Pharma, okay? And he comes into the position of Secretary of Health and Human Services, and he makes this decision. So just the people who are saying trust the science, there's hardly any scientists involved in this process, okay? I just can't stress that enough. We literally had politicians make the decision that science wasn't fast enough, and so we have to go the political route, the declaration of emergency route. Okay, so first of all, President Donald Trump, who's a real estate investor, etc., made the emergency declaration, and then Alex Azar, who's a lawyer basically, he's a JD, made the decision that we need to start developing these drugs. So, and then page 2, this is interesting. So we're going through a biologics license application. This is what was actually approved, okay? The license was approved, okay? So people get confused, licensure and approval. What's the difference here? Okay, so what they actually did is they approved the biologics license application. And this is fishy, to say the least, because there are apparently no biological components in the yuckily named Comirnaty. But let's go over to the code and see the definition of biological product. A biological product is a virus, therapeutic serum, toxin, antitoxin, vaccine, blood component or derivative, allergenic product, protein or analogous product, or arsphenamine or derivative of arsphenamine, or any other trivalent organic arsenic compound, applicable to the prevention, treatment, or cure of a disease or condition of human beings. So, these are all mostly biological things. The only thing that's different is arsphenamine. This is an old, this is the first treatment developed for syphilis. And I think this part of the code is written in the 1940s somewhere, so it's an outdated thing. And this inclusion of arsphenamine, I mean, it's organic, but it's not biological, right? All these other things basically are biological. They're derived from a living organism. And, and this arsphenamine is not used in prevention. I mean, it could be, I suppose, but it's used in the treatment, So the inclusion of this arsphenamine bit is the only thing that tells me that maybe we're going for the biologics license because that's the only applicable thing. It makes sense. I mean, if I was a lawyer, I think we could probably, tear that apart a little bit. But anyway, it's not a biologic. We know that, but that's the license that it's approved under. So, and this is a license to, to brew up biologics. That's what that's for. And so the EUA was revised in this part. I don't even think I'm going to read this. It's just different things, expiration dating, and warnings for myocarditis and pericarditis. Thanks. So here's what you want to know, though. Note 8, the licensed vaccine has the same formulation as the EUA authorized vaccine and the products can be used interchangeably to provide the vaccination series without presenting any safety or effectiveness concerns. The products are legally distinct with certain differences that do not impact safety or effectiveness. So it's a relabeling, okay? Very unfortunate, you know. But so the one name is approved, the other is still under the EUA, and that's what's going on there. All right, page 3, I'm going to skip. They're just talking about the change in the EUA, I believe. Page 4, oh, no, I got to say something here. Okay, so December 11th, which is the authorization, they had to reauthorize this over and over again, and this is where they found something. I can't remember here, but this one is where they started studying children. Okay. Oh no, this is where they started studying children, 12 years of age and older, and then 12 years. Okay, so these are both related to children, and the only thing I would say is this is, I mean, that's why I didn't read it. This is just, it's moronic. Children aren't getting sick, so why would you ever study this kind of stuff? Just a complete waste of time and propaganda that they're saying that it's effective at all, okay, or safe. I mean, if you give this to your children, you're a maniac. So page 4 had a lot of interesting stuff here because this is where they claim to have discovered that, or determined that a third dose would be effective for people who are immunocompromised. So I'm going to look at these little studies here that they did. This is pretty interesting. So people who are organ transplant recipients routinely receive immunosuppressive drugs to keep the body from reacting to the foreign organ that's been transplanted in there and killing it, and then killing the patient. So this is a good kind of, I mean, you know that they're immunocompromised because the immunocompromise is coming in the form of a drug rather than in a failure of the immune system. So you can generalize about them. And so the size of this first study, 100 individuals, so, you know, it is what it is. 99 of these individuals were vaccinated with a third dose. So no control group in this study. That's a problem. So now when we get into the results of it, which they're saying is success, 67 out of 99 of the subjects tested positive for COVID antibodies. So they're saying that's success if you have the COVID antibodies, and that's 68%. However, only let's see, I gotta look at this. 26 out of 59 of the people who were seronegative tested positive. So seronegative means they did not have the COVID antibodies. So really, the effectiveness is only 44% based on the third dose, because 99 minus 59 people leaves 40. So 40 of these 67 people already had the antibodies left over from the first batch. Okay. So the real effectiveness of the third dose is only 44%, not 68%, which is what they're reporting here. And then also a little bit of a hidden statistic here is that means, therefore, that only 40% of the people who had gotten the jab after 2 doses, only 40% of them still had antibodies after 2 months. Okay, so if you do get the jab, if you're considering getting the jab, only a 40% chance of that still having an immunomodulatory effect on you 2 months later. And so the second, which they're calling and also there's no grade 3 or grade 4 side effects, so that's good. Of course. The next study was 120 individuals, and this was a double-blind, randomized controlled study. So this is, you know, the height of scientific research here. We had a group of 60 and another group of 60 who were all organ transplant donors and had previously received the mRNA vaccine. This is actually the other one, the Moderna one, before we were testing Pfizer. And so 60 of them were given a third dose, and 60 of them were given, 60 of the others were given a placebo. And then 4 months later, this is a long time, then they were looking at the antibodies in their serum to determine whether or not they were still immune. And here we had 33 out of 60 people. So that's a 55% success. But then we had 10 out of 57, so 3 of these people got eliminated for some reason, but 10 out of 57 people in the control group, or 17%, 17.5%, were already immune. So we can presumably say that this 17.5% had the COVID antibodies from the first 2, or they got sick and had them naturally. So, but anyway, we need to look at this number minus this number to get the real effectiveness of this this practice of doing it a third booster shot. And so that works out to 32.5%. You can check my math. 32.5% of people who are jabbed a third time will develop antibodies, or will still have them 4 months later. So that actually works out 32.5% after 4 months versus 44% after 2 months. You know, a little bit of a drop off there, I guess, is to be expected. But this is what they're holding up as the science supporting this practice. I think it's just bizarre. And of course, there's no links. There's no links to these studies, so we just have to take their word for them. That's classy, FDA. At the end, having concluded that the criteria for issuance of this authorization under Section 564C of the Act are met, I am authorizing the emergency use of Pfizer BioNTech COVID-19 vaccine for the prevention of COVID-19. So that's where they get you. And then, additionally, as specified in subsection 3B, I am authorizing the use of Comirnaty under the EUA. Okay, so this is where they're getting into that part that's confusing people. Comirnaty is also covered under that EUA, but that's only for this, for individuals aged 12 through 15 years, or third dose to individuals 12 years or older who have... What? I didn't notice that. Wow. Okay, so they didn't study any 12-year-olds in this study, right? I don't think it said their ages. Yeah, it doesn't say their ages, but yeah. So based on that garbage up here, we're going to give this to 12-year-old organ recipients or immunocompromised. This is just, it's maniacal. So now when we get into the criteria for issuance of authorization, this is where it gets juicy, okay? 3 criteria, which you can go back and you can go to the code and you can find where these are in the code. So first of all, SARS can cause a serious or life-threatening disease. I'm not going to dispute that. Based on the totality of scientific evidence, the Pfizer vaccine is effective. Yeah. How do we know that? It's only been 9 months. But then finally, this is the real humdinger. There is no adequate, approved, and available alternative to the emergency use of Pfizer BioNTech COVID-19 vaccine to prevent COVID-19. That is an absolute lie, totally false. And it was, of course, the FDA, this same woman, we'll get into this at the end, but this same woman who's writing this whole thing is the one who denied the EUA for hydroxychloroquine. So, of course, the reason they denied the EUA for hydroxychloroquine is that it is an adequate, approved, and available alternative to the emergency use of this vaccine. Same with ivermectin, same with azithromycin and doxycycline, and on and on and on. All these medications that have been proven to successfully treat COVID-19. The good news is that those are already approved by the FDA, and so they don't actually need those EUAs that they're going for. I'm not sure what would actually, that would come into policy decisions where where the policymaker is looking for approved uses of a certain drug versus an off-label use. So hydroxychloroquine is approved for treating malaria, which is an infectious disease, and COVID-19 they are thinking is also an infectious disease, so it's an acceptable use that any doctor can prescribe without worrying about losing his license, thankfully. And this just talks about how long the thing can go on for, et cetera, et cetera. No prescription needed for a vaccine. Good. And then her little conclusion. I've concluded, pursuant to Section 564D2 of the Act, that it is reasonable to believe that the known and potential benefits of Pfizer, blah, 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 outweigh its risks. I have concluded, based on that act, that the totality of scientific evidence available to FDA, that it is reasonable to believe that the vaccine may be effective in preventing COVID when used in accordance with the scope of authorization. So she forgot this next. She goes, having reviewed the scientific information available, it meets the criteria for the whole thing. So she forgot, if you were paying attention, she went through this one and this one, but she forgot about this one. I don't know if that's a little Freudian slip or, there's little clues through this that they know they're not doing the right thing, in my opinion. All right, and then here's the ingredients, right? Product description, the ingredients of the vaccine, if you want to look through that. Of course, who knows what's really in here? It's got the mRNA, and then it's got the lipids. It mentions these a lot, and then it's got some other stuff that's just kind of regular. Some people get hung up on potassium chloride because it's used to stop the heart in lethal injections, but I wouldn't get too bent out of shape about that. I mean, I wouldn't take this garbage. At any rate, but so anyway, I think. All right, we read this. And then we're going to skip down to page 9, section G. Pfizer Inc. must submit to investigational new drug application number 19736 periodic safety reports at monthly intervals. So it's an IND. This is a part of the FDA approval, lots of acronyms in the FDA. So it's an investigational new drug. It's not fully approved. So just that's maybe good. Maybe during, like this has happened with if you saw my video on the MSO, it made it to the investigational new drug stage and was quashed for mysterious reasons. So maybe that'll be the fate of Comirnaty. But we'll see. But so that's really where it's at. Okay, it's at the IND phase, and this number you can look it up and learn about it. That's the official number they've given to it. They have to give monthly reports, how many people they're killing. And I'm skipping these. So conditions related to printed matter, I want to say on Y here. All descriptive printed matter, advertising, and promotional material relating to the use of the Pfizer-BioNTech COVID-19 vaccine clearly and conspicuously shall state that this product has not been approved or licensed by the FDA, but has been authorized by emergency use. And the emergency use of this product is only authorized for the duration of the declaration that circumstances exist justifying the authorization of emergency use of the medical product under Section 564 of the FD&C Act. So here we could think that this is saying, oh well, we're still under an EUA, but yes, that EUA only applies to the Pfizer-BioNTech COVID-19 vaccine, not to the Comirnaty. Okay, and so there's a lot more material in this whole paper because this paper is the EUA basically, and when we get into Comirnaty land, then we're into the IND stuff, and we're talking about other sections of FDA and code, etc. So, oh yes, and so this is conditions with respect to use of licensed product. Okay, now we're talking about Comirnaty. Comirnaty is now licensed for individuals 16 years of age and older. There remains, however, a significant amount of Pfizer-BioNTech's COVID-19 vaccine that was manufactured and labeled in accordance with this emergency use authorization. This authorization thus remains in place with respect to that product for the previously authorized indication and uses, i.e. for use to prevent COVID-19 in individuals 12 years of age and older, and for the organ transplant people. And then also, this authorization also covers the use of the licensed Comirnaty product when used to provide a 2-dose regimen for, okay, well, yeah. So this is the authorization applied to Comirnaty, okay, which I mentioned earlier, but she's just restating it there. And that's it, all right. How long is it going to last? As long as it needs to last, as long as this is still the EUA we're talking about, okay. The EUA lasts as long as the pandemic lasts, as long as the emergency, the state of emergency lasts. So they do have to check in every month or so, but that's that. All right, it's real. Stuff's gonna get real, guys. So who's doing this? As a final note, Rear Admiral Denise M. Hinton, the chief scientist. Sounds very sciencey. So let's go over to her FDA bio. There she is. Put a name to the face. Rear Admiral Denise Hinton. Thank you very much. Yes, and ladies can be mass murderers too. Go on, brush your shoulders off. Can't criticize her, right? Because of the color of her skin and her gender. But when we go down and look at her training, she earned her Bachelor of Science in Nursing from Florida State University. Good. She earned her Master of Science from Boston University. Good. And then she earned her PhD. Wait, no PhD? Wait. But she's a scientist. Oh. Well, so there you have it. So the chief scientist for the FDA, the Food and Drug Administration of America, has a master's degree in science. So color me a little underwhelmed, but that's where we're at. So, and then one thing that annoys me when we're talking about this kind of stuff like science is, you know, a lot of people will say, oh, if you don't have a PhD, then you just can't open your mouth. Like, I don't have a PhD, right? I only have a bachelor's, and it's a bachelor's in music. So where does my qualifications come in? Well, so the thing of science is something you do. And what a scientist does is he or she conducts research, and usually the measurement or the output of their research is determined by publishing data, publishing papers based on that research. You know, the findings. So I went to see what she has written, and I found 2 papers, and the most recent one, which was 2020, right, is about social media, right? Assessment of public and patient online comments in social media and Food and Drug Administration archival data. Oh my lord, this is what this woman's doing with her life. And then this one's from 1992. Stabilities of hydroxyl radical spin adducts of PBN type spin traps. So she probably has a master's in chemistry or something. That's nice. So, and this is probably just what she did, I'm guessing, 1992 during her master's study. She wrote 1 paper, and she is the woman who decided, based on her sciencey science, that a vaccine, which typically takes between 5 to 10 years, was good to go after only 9 months, despite having killed 13,000 people by their own figures. So God bless you, Denise Hinton. So completing our trifecta then, our trifecta of science, we had Trumpo, Orange Man, let's give him an honorary PhD, Dr. Orange Man, who issued the state of emergency. Then Then we had Alex Azar, who issued the, what was it called? he determined that there is a public health emergency that has a significant potential to affect blah blah blah. And then, yes, declared that circumstances exist justifying the authorization of emergency use of drugs. So he got the ball rolling on this, and he handed it off to Denise Hinton, Master of Science. And that's where we're at. So, moving forward, heaven help us all. You can at least look forward to more scathing comments from me. Sorry, I'm a little worked up. But this has been Evan-Benton of Dogg for Mayor. Please leave some comments down below. Share this because, good lordy, it's a bit of a long one, but people need to know. If you can support my channel anyway, I would love it. I would love to be able to keep doing this and maybe do it full time. And leave any comments below if you have them. Thanks for watching.